pollution contributes to a range of health problems. Most at risk are pregnant women, the elderly, those with long-term health conditions, and children who can grow up with 10% less lung capacity. The health costs of air pollution are twice as much as obesity, but we can all reduce its effects. At Barts Health NHS Trust, we teamed up with local authorities, central government and the third sector to create a cleaner air programme with practical steps anyone can take. For example, switch your trip. Try more active ways of travelling to work, like walking, cycling low pollution routes, or car sharing. Avoid pollution. Our clinicians helped thousands of patients to use quieter routes with pollution maps and sign up for AirText, while pharmacies gave out pollution awareness packs. Reduce home pollution. Our community health professionals talk patients through warm and well packs with 6 no-cost heat-saving behaviours. Drive efficiently. We reduced emissions on 30,000 patient journeys every month through smarter driving and not letting engines idle. Creating breathing spaces with the help of our volunteers, we constructed gardens for our patients with pollution-eating plants that scrub pollutants from the air. The key to success is collaboration. Through our partnerships and actively involving clinicians and local people, we've reached over 100,000 East Londoners with our air pollution messages, and 11 million through our media work. Reducing the effects of air pollution isn't brain surgery. Anyone can do it, from kids to, well, brain surgeons. Find out more and see what you can do.